Hello everyone, welcome to Pediatrics by Dr. Anand. Today we'll be studying about femoral triangle, one of the very basic and common topic, femoral triangle. The video will be taught by one of my very good junior. His name is Sidharth Chauhan. So let's study a little bit about femoral triangle.
Hello friends, myself Sidharth Chauhan. Welcome to Easy Medicam. So today's section of the video will be covering about the femoral triangle. In this section of the video we are covering about, first we are going to cover about the boundaries of the femoral triangle, and second we are covering about the floors which are actually there are 4 muscles which are making the floor of the femoral triangle, and next at last we are going to cover about the contents which are present in the femoral triangle. First we are going to cover about the boundaries which are making the femoral triangle. Actually there if this is a triangle, the 3 boundaries must be present. Okay, this femoral triangle is present on the anterior surface of our thigh. If I am going to draw a rough diagram here to present a femoral triangle, if this is the thigh, so this femoral triangle is present on the anterior surface of our thigh. Okay, and if this is the anterior superior iliac spine and this is the pubic tubercle, actually this side is the medial side of our thigh, medial side, and this is the lateral side. Okay, this is the lateral side of our thigh. So on the medial side the anterior superior iliac spine is present, anterior superior iliac spine is present, and on the lateral side the pubic tubercle is present. Okay, on the lateral side the pubic tubercle is present. So one side of the femoral triangle is made by the connection between the anterior superior iliac spine and the pubic tubercle. This connection is called the lingual ligament. So this is the lingual ligament which is connecting the anterior superior iliac spine and the pubic tubercle. So this is the inguinal ligament. And the next 2 sides which are making the femoral triangle are actually on the medial side the one muscle is present, and on the lateral side the another muscle is present. So on the medial side the muscle which is present is the Sartorius muscle. Sartorius is present here. And on the lateral side or the lateral aspect of the anterior surface of our thigh, the muscle which is making the lateral border of the femoral triangle is the adductor longus muscle. Adductor longus. Okay, so these are the boundaries which are making the femoral triangle. The superior boundary or the superior border of the femoral triangle is made by the lingual ligament, and the medial aspect of the femoral triangle is made by the Sartorius muscle, and the lateral aspect of the femoral triangle is made by the adductor longus muscle. So these are the boundaries which are making the femoral triangle. Next we are going to cover about the floors. Actually there are 4 muscles which are making the floor of the femoral triangle. 4 muscles are present. The muscles which are making the floor of the femoral triangle are, first one, okay, this is one muscle which is making the floor of the femoral triangle. This is another muscle, and this is third muscle. This is the first one, this is the second one, this is the third one, and this is the fourth one. So these are the 4 muscles which are making the floor of the femoral triangle. The first muscle which is making the floor of the femoral triangle is the iliacus muscle. Iliacus. The second muscle is the adductor longus. The third muscle is the pectineus muscle. And the fourth muscle is the psoas major. Psoas major. Actually the tendon of the psoas major is present here, not the muscle, but it is a tendon which is making the floor of the femoral triangle, which is the psoas major tendon. So these are the four muscles which are making the floor of the femoral triangle. Now next we are going to cover about the contents which are present in the femoral triangle. Actually here we are going to cover about the nerves, arteries and veins which are present in the femoral triangle. First, the name itself suggests that if this is a femoral triangle, the nerve name is also a femoral nerve. Femoral artery is present here and the femoral vein is present here. So the contents which are present in the femoral triangle are first one, the femoral nerve is present here. Next one, the femoral artery is present here. The third one is the femoral vein is present here. But in this part, what we have to remember that from the femoral vein, this is the landmark. Femoral triangle is a landmark from where the greater saphenous vein arises from the femoral vein. Okay, the great saphenous vein arises from the femoral vein from this femoral triangle at the level of femoral triangle. Okay, great saphenous vein arises here. So these are the contents which are present in the femoral triangle. Actually this femoral nerve, artery and vein we are going to cover from the lateral to the medial aspect. Okay, so this is the femoral nerve. If this is the femoral nerve, this is the femoral nerve at the lateral aspect. This is the femoral artery and this is the femoral vein. Okay, from the femoral vein, the great saphenous vein arises at the level of femoral triangle. So this is all about the femoral triangle. We covered about the boundaries, we covered about the floors, which are actually there are four muscles which are making the floor of the femoral triangle. Next we covered about the contents which are present in the femoral triangle. So this is all about the femoral triangle. I hope you like the cover of mine. If do so, please like, share and subscribe my channel and press bell icon for more notification. Thank you.